Hello everyone, welcome to the University Technology Mara Medical Department. Here we have compiled videos of core physical examinations. Those examinations include cardiovascular examination, respiratory examination, abdominal examination, upper limb examination, and lower limb examination.
First, introduce yourself to the patient and explain what you plan to examine. Ideally, all patients should be offered a chaperone before any examination. Remember to apply alcohol gel on both your hands before examining the patient. Ensure the patient is adequately exposed before looking at the patient's hands. Examining the hands, you should appreciate for signs such as clubbing, chronic liver disease in the form of leukonychia, Dupuytren's contracture, palmar erythema, and also anemia in the form of koilonychia. Also look for any evidence of bruising and needle track marks. Next, calculate the patient's heart rate. Then, ask the patient to straighten out his arm and cock their wrist back. Observe for any flapping tremors. Next, appreciate the patient's face. Look for any evidence of conjunctival pallor. Look into the patient's mouth for overall dental hygiene and candidiasis. Now, lie the patient flat. Ensure the patient is at eye level. Examine the chest as well for evidence of gynecomastia, spider nevi, and any loss of axillary hair. Explain to the patient you'll be palpating the patient's abdomen. Palpate all 9 quadrants. If there's any pain or suspected pathology, start in the quadrant opposite this. Otherwise, start in the left iliac fossa and palpate in a sequential and ordered manner, as shown in the video. Start with light palpation, using one hand, then move on to deeper palpation using both hands. Try to appreciate for any underlying mass. Next, palpate for the liver edge. Gradually slide your hand from the right iliac fossa to the right hypochondrium with every inspiratory effort taken by the patient. Next, percuss for the liver edge, again starting from the right iliac fossa to the right hypochondrium. Next, palpate from chest downwards to look for the upper border of the liver. Using a tape measure, measure the breadth of the liver. Now, palpate for the spleen. Start in the right iliac fossa and move upwards, gradually sliding your hand with every inspiratory effort to the left hypochondrium. Also, percuss from the right iliac fossa to the left hypochondrium. Next, Ballot for the kidney. If there is any suspicion of abdominal distension, shifting downwards can be elicited. First, percuss the abdomen from the umbilical region, moving laterally towards the left hypochondrium and lateral abdominal region. If there is any changes in the percussion note from being resonant to dull, get the patient to roll in the right lateral position. After 30 to 60 seconds, re-percuss the left lateral abdominal region. If there's a change in the resonance, shifting downwards is demonstrated. Next, check for pedal edema. You should thank the patient and ensure that the patient is covered up and comfortable at the end of your examination. Remember to complete your examination by examining for other lymphadenopathy and also by stating that you'd perform an inguinal examination for lymphadenopathy, an examination of the hernia orifice, and also a per-rectal examination if only indicated.